Is your dog getting TPLO surgery? If so, stick around. In this video, I'll share our experience with our dog Ollie getting bilateral TPLO surgery, setting up a recovery area, and bringing him home. Today we get your surgery, provided a fluffy tushy, ready to go. Ollie tore both of his CCLs a few weeks ago, and today is surgery day. He has not had anything to eat or drink since midnight last night. Okay, baby, time to go in. Here we go. Hi, baby. Check-in was for 8 o'clock, and we made sure to bring his Help Him Up harness so that they could put that on him after surgery. Chris and I went out to breakfast, and we headed home to get ready for the day. While Ollie was in surgery, we decided to set up his recovery area. We put down a waterproof picnic blanket. You can see the dogs playing on it, and we picked up this area rug that we got from Walmart for about $25 with the intention that we'll probably just throw it away after the 8 weeks of recovery, give the dogs a little pet. And here we're setting up the pen. We purchased that from Amazon. We've rearranged it a few times trying to figure out what the best layout is. And we have some pee pads. We thought maybe we should put those down in case he has some accidents. Rearranging a few times, trying to make sense of the best way to do it. We put down his water bowl and his food bowl, put some toys in there. And here's the final setup. Huxley is interested in the bone that's in there. Apparently, he'd rather have that than the one that's sitting right in front of him. We have a good friend who works at the vet that was able to get some behind-the-scene pics for me of Ollie getting prepped for surgery, also his x-rays showing his new hardware. We soon got the phone call that we could come pick him up while he was coming out of anesthesia. Time to go get him. Is my baby in there? Where's my baby? Hello, sweetie. Are you ready to go home? They had Ollie bundled up in some blankets because he was chilly, and as you could see there, he had peed, which they said is normal for coming out of anesthesia. He even had some drool in his cone. This is our first look at his little chicken leg, and yeah, he's definitely a little bit out of it. So we got him home, getting him in, getting him settled. There's our son Cody. And this is the first look at his incisions. Everything looks good. Getting some pets from brother. And we wanted to go ahead and get him settled in. The surgeon recommended that we don't actually have blankets in his recovery area once he's up and starting to move, but at this point he couldn't even bear any weight at all. He was quite numb from the nerve block. So faced him towards us so he could see us in the kitchen, and he got all settled in. This was our experience with Ollie on the day of surgery and bringing him home. A few things that's good to know. First of all, they should be in their recovery area all the time, with the exception of when you take them out to use the bathroom. For those first 8 weeks, it's imperative that they stay safe. They're away from, like for us, the other dogs, so that he doesn't get injured. He also can't be on any hard floor, like hardwood floors or anything like that. We made sure that we had that thin carpet put down, something that was low pile, and he couldn't get caught on, like nothing that would like scrunch up like a throw rug. Ollie was not interested in food or water at all that night. He was still really kind of out of it. He wouldn't weight bear at all. The surgeon told us that was pretty normal. It takes maybe 2 or 3 days for the nerve block to wear off to where they can start to weight bear, but when he does, it's more of an 80-20, so 80% on him, 20% for us holding him up. Just make sure that he doesn't slip and fall or anything like that. Ollie was sent home with 4 medications, 2 that he had to start that night, and then everything starting the next morning. He actually slept through the night. We were told that the first night or 2 can be pretty rough. He was actually great. He didn't cry. The surgeon told us that if he did, he said that's not that he's in pain. He is completely numb. He's still coming out of anesthesia, but that is why they whine, because they're kind of still seeing the purple elephants. They don't know what's going on, but it's not because of pain. We did cover him with a blanket that night because he wasn't weight bearing. He wasn't getting up at all until he was kind of chilly. He did sleep with a blanket on that night, but then after that we took it out of there so he wouldn't trip. There are stages in recovery the surgeon told us that we need to follow. Along the way, we are sending the surgeon like pictures every couple days. We will be doing more follow-up videos following Ollie's recovery. Keep an eye out. Hopefully we can share our journey with Ollie, things that we were told by our surgeon, and the tips and tricks that we've learned so that you can be prepared when your dog has TPLO surgery.